Hi everyone. Today's the day after my chemo session, which went really well. I did ring the bell for completion of the chemo, my 4 sessions of chemo, cisplatin and adiposide, and now I have to take oral adiposide today and tomorrow yet, and also steroids today and tomorrow to prevent nausea, because cisplatin really tears your stomach up. But anyway, I do have that behind me, and every day or every time I have chemo, I have to see the doctor first. I have to have my labs drawn and make sure all my blood counts are okay, which my kidney function and my liver function, which were all perfect. So sometimes there's a delay. You have to wait a week until your cells regenerate, but mine were all perfect. So I was able to go ahead with the last treatment, which I was glad of, obviously. So I have that part of it done, and just when you think you have everything done, then after I saw the nurse practitioner in the room before my chemo, my oncologist doctor came to visit me while I was in the infusion chair and brought up PCI treatments for my brain. This is something that I have researched a small amount on. I am aware of them. The deal is, when you have small cell lung cancer, there is a good possibility or a possibility that the cells can break loose and they go to the brain for some reason. Non-small cell lung cancer patients usually do not have the same risk, but small cell lung cancer patients do. Although I was able to have the surgery and have it removed, which puts me in a better place than someone with small cell lung cancer that was not able to have their cancer removed and was just relying on radiation of the tumor itself and the chemotherapy to shrink the tumors, where I was actually able to have all of the cancer actually cut out and removed. So I would think I would stand a better chance of not having a recurrence in my brain. But they're called PCI treatments, and it stands for prophylactic cranial irradiation. And basically what they do is radiate your brain. You have a healthy brain with normal tissue, and I've already had an MRI. There is nothing there. There's no tumors or anything. They would radiate the brain, and I believe they try to avoid certain areas of the brain that control certain functions so they don't damage it. But there is a lot of talk about people that have memory loss, agitation, changes in their behavior, overall incredible fatigue, not to mention it would prolong my hair loss. It's just not a fun thing. I'm going to think hard and long before I make a decision to do that. Basically, I've decided to not do it and just take my chances. I will have a lung scan, a CT scan of my lungs on July 15th, and then I meet with my oncologist on July 16th in follow-up of the CT scan. Hopefully that'll be clear, and my left lung will be clear, and the lower lobes of my right lung will be clear. And there won't be anything that shows up. I think they scan you basically from your collarbone to your pelvis with the CT scan. It's not like a PET scan where they do your whole body. And then you have scanxiety from the time you have the scan until the time you learn what the scan showed. At least I won't have to wait any longer than 24 hours. But just glad that my chemo sessions are completed, and now I just have to worry about whether to do the PCI treatments. If anyone that's watching this video has any experience with PCI, I'd appreciate any comment that you might have. I might lean on my inspire.com friends and ask their opinions on things. But right now I'm kind of thinking I don't really want to radiate a perfectly good brain and have to go through that. I'm sure I wouldn't be able to work, so it would just be a prolonged attachment to my disability, which wouldn't be good because I lose my 100% pay on July 14th, and then I drop to 65%, which obviously it's pretty hard to make ends meet in a normal household when you lose 35% of your pay. So it's just kind of a worry, but at this time I think I'm going to decline the treatments maybe sorry in the end, but I need to do a little bit more research on it. So I just wanted to report those things that I'm doing. I'm doing well today, drinking lots of fluids and taking my follow-up meds. So I will talk to you later, and thanks for tuning in. Talk to you later. Bye.